Hi, welcome to Nurse Chats. Today, let's just talk about broken bones, okay? Yes, I have had broken bones. I didn't have a single break till I don't know, I think I was in my 40s. I was in an auto accident and the steering wheel whipped and I broke my thumb. Other than that, I had had no fractures and I was very proud of that. So often I would say, no, I've never had a broken bone. And yay, you know. And I skied and I've done a lot of things, horseback riding and whatever, but I didn't have broken bones. So unfortunately, when I was 62, I had a major fracture of my right femur. Not only did it break the original break, but it also shattered when the paramedics put me in an immobilizer. So I have a rod and 9 screws in my right leg. That was after 2 knee replacements. So I have a lot of metal in my body. But I also broke my wrist. Not fun. So between the wrist and the leg together, it was quite the journey. But you know what I hear people say all the time? Uh, and I've heard this a lot. People say, I had a fracture, but I didn't have a break. Or I had a fractured bone, but not a broken bone. A fractured bone is a broken bone, by the way. And I always have to kind of bite my tongue when people say that because I want to say right now, uh, that's a broken bone. So yes, hairline fractures and fractures like that uh, are described as a hairline fracture, but it is a break in the bone. When you break a bone, uh, most importantly, usually it needs to be immobilized, right, so that it can mend. So that's why we have casts and braces and splints and things that people wear when they have a broken bone. Um, some bones, when you're talking about legs, let's say, require that you're also non-weight bearing for a while. So non-weight bearing means that you're not going to put any weight on that leg, and that usually at least 12 weeks. So it takes a while for a bone to mend, but once they mend, they're happy and they're strong. You don't have to worry about them anymore because they can't say, oh gosh, I have a broken bone. You actually have a healed bone. And on my particular femur problem, I would look at the x-ray and I didn't understand this. You would see bone growth not at the fracture site, but down the leg further. So I never did understand that. They did say, "Oh, there's bone growth," and I'd be like, "But that's not on the spot. That's down there." And whatever happens, that PTs and doctors could explain it way better than I can. But you actually increase bone, and you see it happening. And then sometimes with certain injuries, scar tissue is actually what the physical therapists talk about that they want to see. So it depends on what's going on with the break. Okay, things like when I broke my thumb, that was just a quickie, and basically in the world of fractures, where you just immobilized it in a splint for so many weeks, and then it was time to take the splint off. When you take the cast or the splint off of the previously broken area, you see something usually often, especially with regard to wrists and arms and legs, and that is called atrophy. And atrophy means that the muscles that weren't used because you weren't weight bearing and you were protected in this cast for so long, they shrink. And then that's one lay way of saying it. They shrink, and then that's called atrophy. So a lot of times you'll see somebody take a cast off and they have this, well, my brother called it the pickle leg. He had one leg that was so withered, looking to him. And it was after his cast was taken off. And that's expected, okay? So you're going to have atrophy, and it's going to take time for that musculature to re-engage and strengthen. So that's where that physical therapy comes in after the fracture. The other thing about fractures is you can have certain fractures like mine, femur, you can have a blood clot. So I had a motorcycle accident patient one time who had both femurs broken. And it was something like, I heard then that he was put in the ICU because there's like something like a 90% chance of getting a blood clot to the lung. The femurs are it's the largest bone. It's your thigh bone, the upper thigh. It's the largest the largest bone in the body. It produces bone marrow. It's got a lot of roles, believe it or not, in immunity and then hemorrhage and clotting. I'm very grateful, oh my gosh, that I never had a clot after my large femur break. I'm sure they put me on anticoagulants, blood thinners. I don't remember. I was just not in the place to remember all those details. But broken bones, usually, I don't know if you've ever heard this. People say, oh, a break's easier to fix than a sprain or a strain. Why? Because you're actually made to, non-weight bear and immobilize. So sprains and strains, we don't put casts on those, right? Because of the swelling and that bruising and all the problems that go with those. We put something else on there like a splint. And people don't honor those as well as the breaks. If you've got a broken leg, you're not gonna like cut your cast off. But if you have a sprained ankle, you might want to put weight on it and not pay attention. And then, like I told you before, you can add your recovery time by the months if you don't honor a sprain or a strain. But breaks are a little different, and they have a lot of different risks as well. And so those of you who are out there suffering from a broken bone at the moment, just be patient. The process, you cannot speed the process up. I mean, you can do some things, of course, eat better, follow the directions of the doctor, immobilize, cast and whatever. But the truth is, you can't control how fast you're going to heal. Now, watch for infection with fractures. This is, like I say, a variety of things that happen with fractures. I had such a large injury with both my wrist and my femur that I didn't realize that it would take many more calories to heal. And I was actually on a weight loss program prior to them getting injured, and I was darned if I was going to start losing ground just because I was in the hospital. So I was eating not enough calories, actually. And so that didn't serve well because I had more pain. I was having a problem. And then once the doctor said, you have to increase your calories. To heal this, you have to have more, and you have to have more volume because I had hemorrhaged and stuff. So understand that it takes a little more for your body to heal, and that you have to be patient. And if you are, guess what? It goes faster, and that's better. You can get better faster, okay? And it's great talking to you today, and I'll look forward to talking to you next time, okay?